Today we're going to be drawing out some important structures in the axilla. For this drawing you'll need some blank paper and some pens of various colors. The first notable and seemingly complicated structure we will draw is the brachial plexus. But you will see with continued practice and drawing it becomes second nature. A nerve plexus is an intermingling of nerve fibers, often to develop an extensive network of redundancy to protect against proximal nerve injury. I'm going to begin my drawing from the spinal cord to illustrate some important distinctions. You can choose to draw these structures as well, or begin drawing in a moment. Remember that because the first spinal nerve leaves superior to the first cervical vertebrae, although there are only 7 cervical vertebrae, there are 8 cervical spinal cord levels and spinal nerves. The brachial plexus, the major nerve plexus that innervates the upper extremity, most commonly originates from 5 spinal cord segments, beginning above the 5th cervical vertebrae at the C5 spinal cord level. The other levels progress down the spinal cord, including C6, C7, C8, and T1. Of course, there are slight variations to this, as not all bodies read the textbook. Some fibers from more superior or inferior spinal nerves may also be included, but these 5 levels are the main ones we need to remember. The brachial plexus is divided and classified into 5 different sections. The first section of the brachial plexus is referred to as roots. These are different from the ventral and dorsal roots in the spinal cord. These brachial plexus roots are essentially the ventral rami of the spinal nerves at these levels. This is because development of the upper extremity begins as a ventral structure before moving laterally. There are 5 roots correlating to the 5 spinal cord levels: C5, C6, C7, C8, and T1. The second section develops as the roots combine to form trunks. There are 3. The 2 superior roots combine to form the superior trunk. The 2 inferior roots combine to form the inferior trunk. The middle root does not mix just yet and is called the middle trunk. This wavy line will designate where our clavicle would be. The third section of the brachial plexus are called divisions. Each of the 3 trunks divide into anterior and posterior divisions and recombine into cords. The anterior divisions from the superior and middle trunk merge to form the lateral cord. The anterior division from the inferior trunk continues to form the medial cord. The posterior divisions from all 3 trunks join in the middle to form a posterior cord. These names are descriptive of their location in relation to the axillary artery, which runs through these structures. As I said before, the nerves in the 4th section are called cords. The names of these cords make more sense if you imagine the flow of appendicular structures from the spine bending near the shoulder and descending down the upper extremity. This orients the top cord more laterally and the bottom cord more medially within the shoulder, thus named the lateral cord and medial cord. The posterior cord is formed from posterior divisions and courses deep to the axillary artery. Now we have reached the major branches of the brachial plexus. Each cord will branch into 2 main nerves, the medial and lateral cords forming a characteristic M anterior to the axillary artery. Let's draw this M now. The first branch of the lateral cord will continue as the musculocutaneous nerve. This nerve travels deep to the coracobrachialis and biceps brachii muscle to innervate the anterior compartment of the arm before terminating as the lateral cutaneous nerve of the forearm, also called the lateral antebrachial cutaneous nerve. The second branch of the lateral cord will merge in the middle with a branch of the medial cord to form the median nerve. These are referred to as the lateral and medial roots of the median nerve. The median nerve follows the axillary and brachial artery down the arm to innervate a large portion of the anterior forearm compartment and into the hand. We will complete the M with the second branch of the medial cord, the ulnar nerve. The ulnar nerve travels down the arm medially, passing posterior to the medial epicondyle of the humerus, and then innervating a couple anterior forearm muscles and many intrinsic muscles of the hand. The posterior cord also has two main branches, forming the axillary nerve and radial nerve. The axillary nerve dives posteriorly through the quadrangular space to innervate the deltoid muscle. The radial nerve also dives posteriorly, wrapping behind the humerus to travel in the posterior groove, and innervates muscles in the posterior compartment of the arm and forearm. You can remember the progression of descriptive terms by using various mnemonic phrases. Personally, I use "remember to drink cold beer." To finish off our diagram of the brachial plexus, we will add in a few other branches that originate from these structures. First, we will draw the long thoracic nerve. This typically branches off of the ventral rami of C5, 6, and 7. Also originating from the roots is the dorsal scapular nerve that branches off of the C5 root. There are two nerves that branch from the superior trunk. These are suprascapular nerve, which will course towards the suprascapular notch, and the nerve to subclavius, which innervates the subclavius muscle deep to the clavicle. Our next branches will come from our cords. There is one branch of the lateral cord. This is the lateral pectoral nerve. The posterior cord has three branches. These will be the upper, middle, and lower subscapular nerve. The middle subscapular nerve is also referred to as the thoracodorsal nerve, which supplies the latissimus dorsi muscle. The medial cord has three branches as well, and all three of these have medial in their name. First, we have the medial pectoral nerve, which will pierce through pectoralis minor on its way to pectoralis major. The medial brachial cutaneous nerve, and the medial antebrachial cutaneous nerve, also called the medial cutaneous nerve of the forearm. And now we're finished with our brachial plexus. The second structure we will draw out are the branches of the axillary artery, which also travels through the same space. Again, I will be drawing the heart and aorta to better orient, but you can start drawing once we get to the highlighted artery. The axillary artery is a continuation of the subclavian artery, which is a direct branch of the aortic arch on the left and a division of the brachiocephalic trunk on the right. As the subclavian artery leaves the thoracic cavity, it passes between the clavicle and first rib, also called the thoracic inlet. I'm going to extend the line of our clavicle. It is here that we start referring to the vessel as the axillary artery. The axillary artery becomes the brachial artery at the inferior border of the teres major muscle. The axillary artery can be subdivided into three discrete sections depending on its relationship to the pectoralis minor muscle. The pectoralis minor muscle reaches from the anterior ribcage towards the coracoid process of the scapula. In this manner, it crosses over the anterior aspect of the vessel, dividing it into these three parts. We will call them the first part, second part, and third part. The first part of the axillary artery, before it reaches the pectoralis minor muscle, has one branch, This branch is the superior thoracic artery. This artery will travel anteriorly to supply muscles on the anterior wall. The second part of the axillary artery lies deep to the pectoralis minor muscle. This part has two branches. The first branch is the thoracoacromial artery, also called the thoracoacromial trunk. This artery has four major branches. The first is the pectoral artery, which travels between the pectoralis minor muscle and the pectoralis major muscle. One branch will travel back towards the clavicle, called the clavicular artery. One will travel towards the acromion of the scapula, called the acromial artery, and one branch will travel towards the deltoid, called the deltoid artery. The second branch from the second part will also travel anteriorly. This is called the lateral thoracic artery, which also supplies the anterior and lateral thoracic wall. The third part of the axillary artery, between the pectoralis minor muscle and the inferior border of teres major, has three branches. The first major branch is the subscapular artery. This artery will also branch. The first branch will travel posteriorly towards the scapula. This is called the circumflex scapular artery. The second branch will continue inferiorly towards the latissimus dorsi muscle. This is called the thoracodorsal artery. The second branch, in the third part, is the anterior circumflex humeral artery. This artery will travel laterally to wrap around the surgical neck of the humerus anteriorly. The last branch of the axillary artery is the posterior circumflex humeral artery. This artery will anastomose, or communicate, with the anterior circumflex humeral artery. I'll also add the major branch of the brachial artery, the profunda brachii artery. This artery will dive deep behind the humerus and travel alongside the radial nerve. Like our drawing of the brachial plexus, a mnemonic can also be used for the branches of the axillary artery. I'm sure there are variations, but the one that I like to use is "Screw the lawyer, save a patient." And there we have it. We drew these two structures separately for better clarity, but remember, the axillary artery travels alongside the brachial plexus. In fact, the subclavian artery will lie anterior to the brachial plexus roots as they pass through the anterior and middle scalene muscles, as they pass into the upper extremity. It will then travel anterior to most of these structures until it reaches the M. The median nerve will lay anterior to the axillary artery in the axilla. I hope this video was helpful to get you started on drawing these important structures in the upper extremity. The more that you draw out the brachial plexus, the easier it will be for you to regurgitate it as a helpful diagram during an anatomy exam. When prompted with questions regarding the brachial plexus, I would draw out a simplified version and fill in the areas that were applicable to my question. Just remember, the more you practice, the more you'll know. Good luck with whatever you're pursuing, and I hope you have a good day. See you next time.